Hi, I am Dr. Hardik Jibbat, working as Associate Professor in Department of Pharmaceutical Chemistry at Institute of Pharmacy, Nirma University, Ahmedabad, with interesting and learning episode of B.Pharma on the important unit of steroid 6 from the section of Medicinal Chemistry 2, 6th semester, which is prepared by me. Let's start our episode while taking a look at what we are going to learn today. Module 1, we will go with the introduction to methandienone. Module 2, we will start with the synthesis of methandienone from methyl testosterone. Module 3 contains introduction to stanozolol. And Module 4 contains the synthesis of stanozolol from methyl testosterone. Let's start with the Module 1, the introduction to methandienone. Let's start with introduction about methandienone followed by its synthesis from methyl testosterone in Module 2. Methandienone, which is commonly known as the methandienone, is a 17-alpha-methyl delta-1 testosterone or 17-alpha-methyl 1-dehydrotestosterone as shown in figure. It is an orally active anabolic steroid originally developed in Germany. Methandienone binds to and activates the androgen receptor in order to exert its effect. These include dramatic increase in protein synthesis, glycogenolysis and muscle strength over a short space of time. Side effects such as gynecomastia, high blood pressure, acne and male pattern baldness may begin to occur. The drug causes severe masculinizing effects in women even at low doses. In addition, it is metabolized into an isomer of methyl estradiol by aromatase. This means that without the administration of aromatase inhibitors such as anastrozole or aminoglutathione, estrogenic effect will appear over time in man. In addition, as with other 17-alpha alkylated steroids, the use of methandienone over extended period of time can result in liver damage without appropriate care. The 17-alpha methylation of the steroid does allow it to pass through the liver with only a small portion of it broken down, hence causing the aforementioned damage to the liver, which allowing it to be effective when taken orally. It also has the effect of decreasing the steroid's affinity for the sex hormone binding globulin, a protein that deactivates steroid molecules and prevents them from further reactions with the body. As a result, methandienone is significantly more active than an equivalent quantity of testosterone, resulting in rapid growth of muscle tissue. However, the concomitant elevation in estrogen levels, a result of the aromatization of methandienone, result in significant water retention. This gives the appearance of bed gains in mass and strength, which prove to be a temporary once the steroid is discontinued and water weight drops. Because of this, it is often used by bodybuilders only at the start of the steroid cycles to facilitate the rapid strength, increases and the appearance of the great size, while the compounds such as the testosterone cypionate or testosterone enanthate with long-acting esters build up in the body to an appreciable amount capable of supporting anabolic functions on their own. It has also been shown to increase the growth hormone levels by around 40%. Now we will see the clinical pharmacology of methandienone. The anabolic steroids are the synthetic derivatives of the testosterone. Certain clinical effects and adverse reactions demonstrates the androgenic properties of these drugs. Complete dissociation of anabolic and androgenic effect has not been achieved. The actions of anabolic steroids are thus similar to those of the male sex hormones. Anabolic steroids suppresses the gonadotropic functions of the pituitary and may exert a direct effect upon the testes. During the exogenous administration of anabolic androgens, the endogenous testosterone release is inhibited through the inhibition of pituitary luteinizing hormone. At large doses, spermatogenesis may be suppressed through feedback inhibition of pituitary follicle stimulating hormone FSH. Methandienone has been a 17-alkylated to reduce the liver clearance, making it practical for oral dosing. Methandienone acts directly on the androgen receptors, resulting in increased nitrogen retention and protein synthesis. Methandienone is subject to aromatization, yielding the androestrogenic side effects if not offset with an aromatase inhibitor. Now we will see the benefits of methandienone. Methandienone has many benefits and they are as follows. Increased in strength. People supplement with the methandienone will see their strength increase tremendously in record time. Another important thing is the increased muscle mass. If calories are consumed to promote the growth, the methandienone steroid will enhance such growth. It is not uncommon for an individual to gain as much as a 20 lbs in mere weeks from even a moderate doses of the hormone. Of course, some of the weight gain will be water weight, but a large portion will be a lean mass. Increased recovery. Through the use of methandienone, people are able to heal and recover at a faster rate, in turn leading to a more efficient athlete. Another one is the preserve lean tissue. As hard training and activity can destroy the muscle mass, methandienone will enable body to protect it under the stress. Another benefit of the methandienone is the enhanced metabolic activity. Through the use of methandienone, it is possible to gain more lean tissue while gaining less fat. When lean tissue is built, more calories must be consumed than we burn, and often this can lead to fat gain. Through supplemental use of methandienone, we are enabled with the ability to make the better use of our calories and keep the fat at bay. Now, after seeing the benefits of the methandienone, let's see the adverse reaction observed by the methandienone. If you put it into your body, there is a chance of adverse reactions. Take any over-the-counter medications and it will have a host of possible side effects. Side effects of methandienone includes gynecomastia, water retention, high blood pressure, high LDL cholesterol level, low HDL cholesterol level, testosterone suppression, testicular atrophy, and liver toxicity. To combat such side effects, the first line of defense is moderate doses of moderate periods of time. Beyond dosing and duration, as several of these reactions are caused by a build-up in estrogen due to the aromatase process. To combat this build-up, an aromatase inhibitors are needed. And aromatase inhibitors will inhibit the aromatase process, preventing the build-up of the estrogen, and by its nature, the aromatase inhibitors will further reduce the total amount of estrogen in the body. While aromatase inhibitors are useful, live a healthy lifestyle is also important. If people are not healthy, if people are already having blood pressure, cholesterol, liver issues, then methandienone should be avoided. Like most all anabolic steroids, methandienone is intended for healthy adult males. If you are a healthy adult male, consume a diet that is friendly. As it pertains to testosterone suppression and testicular atrophy, when people took supplement of methandienone, their natural testosterone production is suppressed. For this reason, as the testosterone is produced in the testicles, they will produce atrophy. Due to the suppressive nature of the methandienone, it is imperative that people supplement with the exogenous testosterone to give their body the testosterone it needs. Further, while this will not fix the testicular atrophy, once all anabolic steroids use has come to a halt, and once all the hormones have cleared our system, testosterone production will begin again and the testicles will return to the normal size. Another important toxicity is the liver toxicity. As it is stated earlier, it is a C17 alpha steroid. Methandienone carries a liver toxic nature. It is not as toxic as the excess alcohol consumption and not as toxic as many of the over-the-counter medications, but yes, it still carries a strong toxic nature. For this reason, again, responsible use must be implored. If it is, while liver enzyme levels will increase, and because of the liver regenerates remarkably well, the liver enzyme levels will return to the normal once use is discontinued, assuming that no additional stress has been added to the liver. Here we are completing the module 1. Let's start with the module 2, that is the synthesis of methandienone from methyl testosterone. The synthesis of methandienone from methyl testosterone is a simple and a single step oxidation reaction in presence of selenium dioxide as shown in the figure. Selenium dioxide does oxidation of the methyl testosterone and removal of double bond at C1 gives the desired product methandienone. Dear friends, till now you have gained a complete idea about the methandienone and synthesis of the methandienone from methyl testosterone. If you have missed any of the module or content, you may log on to our website www.cec.nic.in to download videos, FAQs, LOR and other contents so that you can be remain updated with this chapter. Now let's move ahead to our next module, which is about the stanozolol followed by the synthesis of stanozolol from methyl testosterone. We will start with the module 3, Introduction to the stanozolol. Stanozolol is a synthetic anabolic steroid derived from the dihydrotestosterone as shown in figure. It was developed in 1962. Unlike most injectable anabolic steroids, stanozolol is not esterified and is sold as an aqueous suspension or in oral tablet form. The drug has a high oral bioavailability due to a C17 alpha alkylation, which allows the hormone to survive the first pass liver metabolism when ingested. It is because of this that the stanozolol is also sold in a tablet form. Let's start with the uses of stanozolol. Stanozolol has been used in both animal and human patients for a number of conditions. In humans, it has been demonstrated to be successful in treating anemia and hereditary angioedema. Stanozolol is one of the anabolic steroids commonly used as a performance enhancing drug and is banned from the use in sports competitions under the auspices of the International Association of Athletic Federations IAAF and many other sporting bodies. Veterinarians may prescribe the drug to improve the muscle growth, red blood cell production, increase bone density and stimulate the appetite of debilitated or weakened animals. Dosage instructions provided by veterinarian should always be followed. Unless otherwise directed by the veterinarian, give stanozolol with food. This medication should only be given to the pet for whom it was prescribed. It may take several weeks before the stanozolol produces the desirable effect. It means increase the red blood cell count in cases of the anemia. Now let's start with the possible side effects of stanozolol. Stanozolol acts like a male hormone. It may cause female animals to exhibit male behavior, which includes mounting or not come into the heat. May causes a water retention and swelling. Stanozolol may increase the calcium level in the blood. This can affect the heart and cause unusual tiredness, weakness, or an irregular heartbeat. Consult your veterinarian if any of the above side effects are noticed, if the pet experiences an allergic reaction to the medications with signs of facial swelling, hives, scratching, sudden onset of diarrhea, vomiting, shock, seizures, pale gums, cold limbs or coma, then the veterinarian should be contacted immediately. We should take some precautions when we use the stanozolol. Stanozolol should not be used in pregnant animals due to the extreme adverse effects on the unborn babies. It should not be used in male animals intending for breeding as it severely reduces the sperm count. It should not be used in animals that have cancer of the mammary glands or prostate. It can cause a severe liver disease in cats and should be used extremely carefully. It causes the water retention and should not be used in patients with heart disease, kidney disease, or the patients being related for diabetic insipidus. Stanozolol can also increase the amount of calcium in blood and may cause severe problems in patients who already have weak hearts. This is the end of module 3. Let's start with module 4, synthesis of stanozolol from methyl testosterone. Stanozolol chemically is a 17-alpha-methyl 5-alpha-androsteno 3,2-C pyrazole 17-beta-ol. It is made by reducing the double bond at C4-C5 in methyl testosterone, which has independent interest as an anabolic drug of methandienone. Methandienone undergoes formylation with the ethyl format in presence of sodium ethoxide, which forms a 2-formyl oxymethylene derivative, which upon reaction with hydrazine easily cyclizes to the desired stanozolol, which is a pyrazole condensed steroid system. Synthetic scheme is shown in figure. Friends, this is the end of the module. Let's start with the conclusion of this module. With all this information, here we come to an end of today's lecture. Methandienone and stanozolol are important steroids required for the development of the body as well as to increase the strength. Methandienone is 17-alpha-methyl delta 1 testosterone or 17-alpha-methyl 1 dihydrotestosterone and an orally active anabolic steroid. Methandienone binds and activates the androgen receptor, and this causes increase in the protein synthesis, glycogenolysis and muscle strength over a short space of time. The 17-alpha methylation of the steroid does allow it to pass through the liver. Methandienone is significantly more active than an equivalent quantity of the testosterone, resulting in a rapid growth of muscle tissues. However, the concomitant elevation of estrogen levels results in significant water retention. It has also been shown to increase the growth hormone levels. Along with this pharmacological importance, it also produces significant side effects, mainly gynecomastia, high blood pressure, acne, and male pattern of baldness, which may begin to occur. The drug causes severe masculinizing effects in women even at low doses. In addition, as with other 17-alpha alkylated steroids, the use of methandienone over extended periods of time can result in liver damage. Now we talk about stanozolol. It has been used in both the animal and human patients for a number of conditions. In humans, it has been demonstrated to be successful in treating anemia and hereditary angioedema. Stanozolol is one of the anabolic steroids commonly used as performance enhancing drugs and is banned from use in sports competitions under the auspices of IAAF and many other sporting bodies. Veterinarians may prescribe the drug to improve the muscle growth, red blood cell production, increase bone density and stimulate the appetite of debilitated or weakened animals. Dosage instructions provided by the veterinarian should always be followed. Unless otherwise directed by the veterinarian, give stanozolol with food. This medication should only be given to the pet for whom it was prescribed. It may take several weeks before the stanozolol produces the desired effects, means the increase in the red blood cell counts in cases of anemia. Stanozolol acts like a male hormone, and so it may cause female animals to exhibit male behavior. It may cause water retention and swelling, may increase the calcium levels in the blood, and this can affect the heartbeat and causes the unusual tiredness, weakness or an irregular heartbeat. Veterinarian should be contacted if the pet experiences an allergic reactions to the medications with signs like facial swelling, hives, scratching, sudden onset of diarrhea, vomiting, shock, seizures, pale gums, etc. Do keep in mind what we discussed today. Time for you to go self-study. This is Dr. Hardik G. Bhatt signing off. If you want to learn more and enhance your knowledge, you may log on to our website for MCQs, quizzes, LORs on www.cec.nic.in. Till then, keep studying. Goodbye. Thank you.